Morning, everybody. This is Dr. Meghana Subhash, consultant pulmonologist at Medicover Hospital, High Tech City, Hyderabad. So, on this auspicious occasion of Independence Day, firstly, I'd like to take the opportunity to wish each and everybody a very happy Independence Day. And we'll be discussing an important topic today, which is freedom from asthma. So, let us understand the present situation in our country. Currently, the asthma burden in India is around 3.8 crores of Indian population is suffering with asthma, and out of which 13,200 deaths are seen annually. So it is a major public health concern and it affects everyone regardless of the age, gender or religion. The commonest symptoms of asthma include shortness of breath, chest pain or chest tightness, and this leads to something called as wheezing sound, and a frequent common cold. These are the commonest symptoms, and along with this we can even have cough variant of asthma. Asthma can be triggered with something as simple as exposure to dust mites at home, or sometimes molds or fungus which grow in the houses or in the window panes, and strong fragrances, perfumes or irritant odor. Cigarette smoking, either active smoking by the patient themselves or passive exposure to cigarette smoke from elsewhere. Some cleaning chemicals which are used commonly in the household, these also can trigger an asthma attack. And one more important cause is pets. People who are having cats or dogs or birds at home, and they have a lot of animal dander, they have a lot of animal sheddings in the house environment. Those can also trigger an asthma attack. So let us discuss some of the common problems faced by asthma patients. One important concern is taking inhaler multiple times in a day. This can be easily avoided. When the patient is on regular treatment and symptoms are well controlled, they should not be requiring more and more multiple dosing of the inhalers. When this thing happens, either the patient has a severe asthma or their symptoms are very much uncontrolled. So they should visit the doctor immediately and adjust the treatment plan accordingly. And also we see there is a lot of stigma attached to asthma and inhalers. A lot of people find it difficult to carry the inhalers or use it in public places. I think we should all, whether asthmatic or non-asthmatic, as citizen of India, we should take the necessary steps to reduce the stigma for asthma patients. They should be able to comfortably use inhaler. What happens is when symptoms go uncontrolled, patients need multiple medication, but this is not a routine scenario. When the patients are avoiding the triggers, taking their medication on time, they don't have to take multiple medicines for this condition. And also one important problem we see is asthma patients, as soon as they get a little benefit, when the symptoms subside, they completely and abruptly discontinue the medication. This should not be done. Whenever the symptoms are under control, the doctor can adjust the treatment, but there is always a need for a preventer inhaler therapy. So today is the day that we take a stand against asthma, and with some of the simple steps which I'll be discussing in the next few slides, we can prevent the attacks, reduce visits to the hospital, and ease those early morning and late night symptoms. The step one is using inhalers regularly. As I already mentioned, even when the symptoms are well under control, we need to continue certain inhaled medication which are called as preventer medicines. The reliever medication is different. That needs to be taken when the symptoms occur despite a regular preventer therapy. But preventer therapy needs to be continued regularly. And most important is the use of inhaler, the technique how you use. It is important that different inhalers have different techniques and the patient learns the technique correctly to ensure that the medication reaches the lung effectively. And all the patients should make an effort to note down what are their triggers. Each individual is different and each person can have a different trigger for their asthma. So it is important that they maintain a small diary and make a note of what are the triggers which they particularly face, and they should make a conscious effort to avoid these triggers. Patient should always have an asthma action plan. This has to be discussed with the doctor and prepared. The importance of this is the patients can, to a certain extent be educated about their symptom control and what to do, when to step up the inhaler and when to step down the inhaler. And also, we can in detail explain the patient and educate them about what to do in case of an emergency scenario. So all this constitutes an asthma action plan, which every patient of asthma should be aware of. And next step is definitely you have to stay active, eat healthy, eat well, and you should also make an effort to manage your stress, because stress management also definitely improves asthma control. Last but not the least, the patient should be keeping a track of their, peak flow meter recordings. They should measure their lung function regularly. This is a simple test which can be done at home, and once in a few months, these recordings can be shown to the healthcare provider, the doctors, so that the treatment can be adjusted if it is required. So with this, I would like to end my talk. Thank you for your patient listening, and I'll be happy to answer any of the queries.